On multiple occasions during his presidency, Donald Trump declared that there are only two genders, male and female. This stance, often reiterated by members of his administration, marked a significant departure from the increasing recognition and acceptance of gender diversity in the United States and globally. Trump's position was not merely rhetorical, it formed the basis of a series of executive orders aimed at solidifying a binary definition of gender within the framework of the federal government. One of the most impactful executive orders was EO 14168, which explicitly defined sex as a biological and immutable characteristic determined at birth. This definition, based on a narrow interpretation of biological sex, had far-reaching consequences, impacting policies related to healthcare, education, and even employment. Another significant order, EO 14187, focused on protecting children from what the administration termed experimental gender transition procedures. This order had direct implications for transgender youth, potentially limiting their access to gender-affirming care. Beyond these specific executive orders, Trump's administration took aim at broader initiatives aimed at promoting diversity and inclusion. Programs related to diversity, equity, and inclusion within the federal government were scaled back or eliminated, signaling a shift away from recognizing and addressing the needs of marginalized groups, including LGBTQ+ individuals. Trump's actions did not occur in a vacuum. They were met with both support and opposition from various segments of society. Conservative groups and a portion of the Republican base lauded these moves, viewing them as a reassertion of traditional values and a necessary corrective to what they perceived as an overly liberal agenda. On the other hand, LGBTQ+ advocacy organizations, human rights groups, and many medical and mental health professionals condemned these actions. They argued that defining gender solely based on biological sex ignored the lived experiences of transgender and non-binary individuals, potentially leading to discrimination and harm. The impact of Trump's executive orders and pronouncements on gender extended far beyond mere rhetoric. Federal agencies were directed to align their policies and practices with the administration's stance on gender, leading to significant changes in how gender was defined and addressed across various governmental functions. One of the most immediate and visible changes was the revision of language and terminology used by federal agencies. Gender-neutral language, often employed to be inclusive of individuals whose gender identity did not conform to traditional binary categories, was largely rolled back. Forms, websites, and official documents were revised to reflect a strict male-female dichotomy, often removing options for individuals to identify outside these categories. The Department of Health and Human Services, or HHS, played a particularly significant role in advancing the Trump administration's agenda on gender. Under Trump's direction, HHS issued guidance to healthcare providers and insurers that defined sex as a binary and immutable characteristic, based solely on the individual's genitalia at birth. This definition had profound implications for transgender individuals seeking access to healthcare, particularly gender-affirming care such as hormone therapy or surgery. Beyond healthcare, the Department of Education under Trump's Secretary of Education, Betsy DeVos, took steps to roll back protections for transgender students in schools. Guidance issued during the Obama administration, which affirmed the rights of transgender students to use restrooms and participate in school activities consistent with their gender identity, was rescinded. This move left transgender students vulnerable to discrimination and harassment, with legal recourse often uncertain and difficult to navigate. The impact of Trump's policies on transgender and non-binary individuals was immediate and far-reaching. Many within these communities described feeling targeted, marginalized, and erased by policies that refused to recognize their identities. The rollback of federal protections had a chilling effect on access to healthcare. Transgender individuals, already facing significant barriers to care, found it increasingly difficult to find healthcare providers knowledgeable and affirming of their needs. Insurance coverage for gender-affirming care, while never universal, became even more precarious as some insurers used the HHS guidance to deny coverage for procedures they deemed cosmetic or experimental. The impact on transgender youth was particularly acute. Many young people who had begun to socially transition, living in accordance with their gender identity, faced increased scrutiny and hostility within their schools and communities. Access to mental health support, often crucial for transgender youth navigating their identities, was also impacted as some therapists and counselors hesitated to provide care for fear of running afoul of state or federal regulations. Beyond the direct impact on healthcare and education, Trump's policies contributed to a climate of fear and uncertainty for transgender and non-binary individuals. Many reported experiencing increased harassment and discrimination in their daily lives, with some fearing for their physical safety. The constant barrage of negative rhetoric from the White House and conservative media outlets created a hostile environment that made it challenging for transgender and non-binary individuals to live openly and authentically. Trump's executive orders and policy changes regarding transgender rights faced immediate legal challenges. Multiple lawsuits were filed by LGBTQ+ advocacy organizations, civil rights groups, and individuals arguing that these actions violated the Equal Protection Clause of the 14th Amendment and Title VII of the Civil Rights Act, which prohibits discrimination based on sex. One of the most high-profile legal battles centered around access to health care. Several lawsuits challenged the HHS guidance that defined sex as binary and immutable, arguing that it discriminated against transgender individuals seeking gender-affirming care. These lawsuits asserted that healthcare decisions should be made based on an individual's medical needs and in consultation with their healthcare provider, not on the basis of discriminatory interpretations of biological sex. Another significant legal challenge focused on Trump's ban on transgender individuals serving in the military. This ban, announced via Twitter and later formalized in a memorandum, was met with widespread condemnation and multiple lawsuits. Opponents argued that the ban was discriminatory, harmed military readiness, and violated the rights of transgender service members who had previously been able to serve openly and with distinction. The legal battles over Trump's transgender policies were not merely confined to courtrooms. They also played out in the court of public opinion, reflecting a deeply divided nation grappling with evolving notions of gender identity and LGBTQ+ rights.